Namaste. I'm Mahendra C. Jadeja, one of the founder member of the Gujaratis in UK, along with my founding members Sarat Bhai Parekh, Praveen Bhai Amin, Ghanshyam Bhai Patel, Lalu Bhai Parekh, Anita Ben Ruparelia, Sanjay Bhai Jagatia, and Mamta Parekh. Welcome you all. Gujaratis in UK is a non-profit and non-fee paying membership organization which exists to provide a voice for the Gujaratis in UK and across the world. Gujaratis in UK have organized this event as it is so important that the people take their responsibility seriously and don't become a relax about this virus is muted. We are predicting a third wave. Stay on the top of this virus by understanding the warning and self-help that is on the offer as the virus continue to evolve. We have an eminent speaker, Dr. Bharatbhai Pankaria from UK, Mr. Rakesh Shah, scientist from Ahmedabad, Gujarat, Dr. Bhavna Ben Pandya from UK are ready to share their knowledge with you. Pandemic continue to rage around the globe. We want to overcome. We Gujaratis in UK want to play our part. We see suffering and loss of lives of our loved one, our older adults, family broken apart, and now younger adults are also at risk. Stay warm and knowledgeable as we face the lethal variants, triple spike, proteins, and mutants. These will come. Now, I hand over to you, to our anchor and a friend of Gujaratis in UK, to Smita Parekh in India. Smita Parekh is the founder of the renowned literature and culture festival, so-called Litofest Mumbai. She is an awarded poet at the young age of the 15 years by the Sahitya Academy. She is a radio jockey, TV presenter, and entrepreneur. She runs India's premium event management company called GLK Global Events. She's also working for a free education for poor kids and has adopted rural villages to make a better India at the grassroots. Over to you, Smitaji. Thank you.
Thank you so much, Dada. As we all call you with love, that's Mr. Mahendra Singh Jadeja. I'm so honored that, Dada, you made me part of this very, very informative and very important panel, which we are going to be discussing tonight, which is presented by Gujaratis in the United Kingdom. And I'm honored because being a Gujarati, I feel the responsibility, to convey this important information to everybody. People who have suffered with Corona, people who are very scared, who are families of patients who have suffered with Corona. It's a global phenomenon right now, and we all must be aware of and prepared for the third wave also. Before I start with our eminent feminist panelists today, I would like to give a brief introduction of Dada Mahendra Singh Jadeja ji. He has actually so many honors and so many awards to his kitty, but I would like to mention a few. He's the chairman, Global Business and Investment Consortium, International Business Advisor, Trustfine Technologies PLC, Director, Handover Plus Limited, Director for Overseas Development for H3O Group, Business Development Manager, India Sanmark Limited. He's been awarded with several awards across the globe, and he's also an eminent part of the literature festival, Litofest Mumbai. And back in 2018, Dada, we hosted the London festival in the House of Lords in British Parliament. Thank you so much for your support. Now I would like to introduce our first eminent speaker of this evening. We have with us Dr. Bharat Pankhania. He's a senior clinical lecturer, University of Exeter, Medical School City, Bath, expert in infectious disease control and emergency preparedness, assisting people, local authorities, governments, and organizations with their coronavirus pandemic responses, keeping people safe and preventing infections. A very warm welcome to you, Dr. Bharat Pankhania, to this eminent panel tonight.
Namaste, namaste everyone. It's lovely to be with fellow Gujaratis and non-Gujaratis alike. Thank you for inviting me. Namaste.
We also have Mr. Ragesh Shah, the Chairman and Chief Scientist, Online Telemedicine Research Institute, Somchand Dosabhai Charitable Trust, Ahmedabad, Gujarat, doing research and development on CBRND, Chemical, Biological, Radiological, Nuclear Defense System, with SOS security and telehealthcare for human, animals, and crops management, including disaster and non-disaster conditions, organizing telehealthcare camp during disaster and non-disaster situations, running manufacturing and software development unit for biomedical sensors and devices for CBRND, system software design and development centers, providing telemedicine treatment at home for physically challenged and senior citizens, including women and children, through SOS security and telemedicine software under Global Telehealth Network, which is also called GTN Network. Good evening, Dr. Ragesh. Very warm welcome to you to this eminent panel. We are really looking forward to see you and hear your prominent thoughts on the pandemic.
Yeah, thank you.
We also will have Dr. Bhavna Pandya will join us. First, we will have conversation with our two eminents, but I will give a brief introduction of Dr. Bhavna Pandya ji. She has joined NHS in 1995 after qualifying from India as a kidney specialist, joined as a consultant nephrologist and physician at Antry Hospital in 2005, also the elected medical and dental staff governor of the trust. Patient safety and quality care at every level is her passion. She is involved in managing COVID patients, particularly those on dialysis and also those who develop kidney failure and COVID years. A very warm welcome to Bhavna Bain Pandya also.
Namaste. Namaste, everyone.
Namaste to you. So I also want to thank all the committee members of the Gujaratis in the UK. We have the eminent executive members of the committee, Mr. Praveen Amin, Mr. Mahendra Singh Jadeja, Mr. Lalu Bhai Parekh, Mr. Sanjay Bhai Jagatia, Srimati Mamta Parekh, Shri Sharad Bhai Parekh, Mr. G. M. Patel, and Srimati Anita Ben Ruparelia. Warm welcome to all of you and thank you so much for initiating this very, very important discussion tonight. So I would like to begin my questionnaire today. My first question will be with Dr. Pankhania. Dr. Pankhania, more or less the whole world is aware about this coronavirus or COVID-19 as we call it. How do you describe this virus? What is the early behavior and symptom of this virus? In your medical words, how would you explain this virus?
Thank you. So this is a new virus that arose in about 2019 November time, maybe a little bit earlier. And we find that the focal point, the place where we've identified the cases and the place where we identified most of the initial cases was in Wuhan in China. So it is a new virus. It's a coronavirus. And the interesting things about it are that it is pretty infectious. And once it has infected you, it goes on to create other types of illnesses which are not confined to your lungs only. So this is the important bit. It starts its infections in the airwaves, the back of the throat, the lungs, and then in some people, it goes on to trigger other issues as well, such as it hurts the heart, the liver, the kidneys, it leads to neurological abnormalities, and it leads to blood clotting and so on. So it is a virus, a new virus that starts its journey by infecting in the lungs and then goes on to create what we call a storm, an immunological storm, which then starts to affect other organs of the body as well.
Thank you so much, Dr. Pathania. So, according to you, I think there are no fixed symptoms and there are a lot of myths about the symptoms. But as far as your expert opinion is concerned, what are the most common symptoms and what are the most serious symptoms of this virus?
So the important bit to be aware of is unusually compared to SARS, which appeared in 2003. This is a slightly different version of SARS-CoV-2. A large majority of people, this is very, very important, a large number of people do not have any signs and symptoms. In other words, no complaint, nothing. And they are also infected and infectious. Of the people who have signs and symptoms, one peculiar, very common and well-known sign and symptom now is sudden loss of smell and taste. There are other signs and symptoms. The other sign and symptoms to be aware of are things like a cough. But the unusual factor of this cough is it is a dry cough. And then there will be other people who complain of muscle ache, tiredness, headache, and then you go on to having the more serious side effects, which are shortness of breath, difficulty with breathing, severe unrelenting headache. And then going on still further, some people will go on to have what we call blood vessel disorders. So they present with signs and symptoms of their blood vessels are inflamed. So you might get patchy red nodules, red rashes on their feet and legs and arms, unusual places like that. And of course, the main thing that people will start to be aware of if they are getting the serious side effects of the infection are shortness of breath, difficulty with breathing, extreme tiredness, unable to climb the stairs, unable to go to the toilet, in fact, unable to turn in bed. And of course, not in everyone, but in many people, you also get a temperature over 38 degrees centigrade. So if I were to summarize, the signs and symptoms are many. Most of them are mild. Most of them are innocuous. The more important ones, the signs and symptoms, are that shortness of breath, that extreme tiredness, that difficulty with breathing, and that usually presents around the latter half of the infection. In other words, day 5, day 4 onwards.
Thank you so much. So in medical science so far, we have been reading about so many experiments as far as the perfect medication is concerned for this virus. Do you feel that the medical science has invented or discovered something which is perfectly fit for treating this virus so far?
No, is the shortest possible answer. So we have various drugs that have been tried, and some of them with some success. But essentially, we haven't got a pill I can give to you which will make you better. So let's talk about what works. So we know that in the latter half, this is very, very important, in the later half of your infection, should you be needing oxygen support at that stage, medication with steroids, such as dexamethasone, appears to be of some benefit, not all benefit, some benefit. So dexamethasone is one of them. Also, similarly, there are some immunosuppressant drugs, again used if needed in the second half of the more severe signs and symptoms stage of your illness, which suppress the immune system. And by suppressing it, they stop further organ damage and they show a little bit of work. I have to say, and I'm really grateful for your question, is in India, you're using too many steroids. Please Do not use a lot of steroids, especially when you've got immune suppressant illnesses like diabetes. So when people have been using a lot of immune suppression drugs, the anti-rheumatoid arthritis ones, plus steroids like bucket chemistry, and you've got your diabetes, and early on in your infection, when really you shouldn't be, it is leading to the emergence of mucormycosis, black fungus infection. And if you get black fungus infection in your nasal passages, in the back of your throat, in your eye sockets, the fatality rate is 50% or nearly 50%. It's 46%. So be careful with your use of immune suppressants. So I must say, and I'm very clear about this, that the hydroxychloroquine, the anti-malarials, do not work. And this is by international studies that we have not found evidence of hydroxychloroquine working, despite what President Trump was promoting. Similarly, ivermectin does not work. And this is very important to know, that you don't go down the path of ivermectin, hydroxychloroquine, excessive steroids. And one more thing I wanted to say is remdesivir. So again, the evidence on remdesivir is not clear cut, and it is only best used in expert hands, if at all. I personally am not convinced about remdesivir. So what does work? Dexamethasone. You need oxygen, and when you need oxygen, oxygen works. What works beautifully are the vaccines. So the vaccines work beautifully. Vaccines from all the platforms, when they are licensed by international independent authorities, they work, and you should take the first one that is offered to you. Pfizer, Moderna, AstraZeneca, Johnson & Johnson, etc. They all work, and you should take whichever one is offered to you. I hope this answers your questions.
I think that's very, very important, because there is a huge panic going around the entire nation of remdesivir and all the steroids you mentioned. And because I'm also working as a COVID warrior, throughout the day, I get 2,000 to 3,000 queries on my social media that people are panicking and it's not available. I think this piece of information is very, very important. I am sure people here in India, whoever is joined our show, is noting down this very important information. I will move on to Ragesh Bhai. Ragesh Bhai, welcome to the show once again. Since we are talking about vaccination, so my question to you is, Dr. Pankharia already mentioned that it's very, very important. But in India, because you are in India and you have been working, into research for this particular pandemic. So people have different kinds of, myths about the vaccination. Some people are boycotting the vaccination. Can you please put a little light on why it is important to take vaccination in India? And can we be sure enough after the vaccination that at least we can prevent this virus for some extent? Ragesh Bhai, to you.
Rakesh Bhai, can you unmute yourself?
Yeah, sorry. Yeah. Now it's okay?
Gigi, we can hear you now.
See, we are exclusively working on CBRND. And when we talk about CBRND, the chemical, biological, nuclear, radiological, nuclear defense system. Now, we look the entire virus as a CBRND. We never have taken the SARS or swine flu or COVID-19 as a specific number, as a virus. We have taken it as a CBRND only, because when we do the research and development, we can't fix up one particular system which has been organized by the world, because world says, okay, you take this name as a COVID-19, so everybody follows like that. But as a researchers, we are going into the depth of it, and we are saying since last couple of years that this is not the COVID-19. This is purely a biological weapon. And based on the output, based on the what you call the treatment, what has been given. Say, for example, just simple example, you are taking in a hot water, the steam, few antibiotic on a initial stages, the vitamin C, D3, and zinc sulfate, which is also the part of the system. These are all which we are doing it for the biological weapons, the social distancing, N95 mask. So none of a single thing which we found, which is not being utilized from the biological weapon. So my question would be, because when we are into the field, of course, when we are talking to someone, we have to use the word as a COVID-19. But on the back of the mind, when we do the research, we have to go with the biological weapon. Now, coming back to the system of it, what exactly our subject was that how we should prepare for the third wave. Because as you understand that from the different world media and a lot of people, they are saying this is a biological weapons. They have come to the some extent by using the word that it is a biological weapon. Now, when we take it up as a biological weapons, there are the 8 to 10 different variants are already present. And when we take it is a biological weapon, it means if you say you are COVID-19 negative, still you are holding some portion of biological weapon inside your body. Of course, it is not active. But when somebody says it is a COVID-19 positive, it means that particular biological weapons which has been came out of the body and it has infected himself as well as if he is infecting other people also. So once he come back to the negative, they are not saying zero. Try to understand me. Nobody says that COVID-19 is now zero for you and you are free from the COVID-19. But people are using the word COVID-19 negative and COVID-19 positive. It means it just goes on rotating in your body for a couple of years. That's the only one thing that is the vaccination, because the vaccination will stop the your immunity of your body will be such that that will suppress the negative COVID-19 which is available in your body, and you have been not been infected for a couple of years till it will get it zero. So my question would be, if you want to get out from the third wave, which means that a lot of variants are available at any given time, this third wave is coming out very fast. As you know, it will affect the people. If you think the people has to go into the system like a children, the immune system will be bypassed through this all variant in next couple of months. At that time, it may happen that the vaccination won't work even. So we are ready with all possibilities that in case of the bypassing of the immune system by these biological weapons, then we should be prepared for the additional dose of a vaccination, which I call it as a third dose, which covers the rest of the other variant. Because at the end of the day, what we need is that we have to get going. Now, you can't get out of it within within a couple of months, if somebody says I'm totally free, forget it. It won't happen like that. When you are come across the biological weapons, it means that it will stay for a couple of years. And while it is stay for a couple of years, only thing will suppress it is the vaccination. And if you increase the vaccination, this particular negative biological content of the weapon will not come out of the body, and you can always say that you are safe to go ahead into the system. Now, I just wanted to give you a few examples. During last 1 year in Gujarat, we have treated more than 10,000 people, positive people, including the police personnel, senior citizen, and a lot of other physically challenged people. Our organization has provided them regular medicine like erythromycin, the vitamin C, D3 if needed. For D-dimer, some people, they need steroid also. So a lot of things which we have provided. But at the same time, our Ayurveda has worked like anything. And why I'm insisting the people in Gujarat, because our Gujaratis are already used to with the Ayurveda system. I'll give you two examples. One with lot of the doctor said you have to admit into the hospital. Now, there is a one Ayurveda medicine, we call it as a Khadiradivati. And that Khadiradivati has worked not only for two people. I use this word, I produce that papers also. More than 5,000 people who are supposed to get to the admission into the hospital. But because of this just small, just 100 rupees bottle, the Khadiradivati, just taken by them for 3-5 days, they have maintained the oxygen level because of the Ayurveda that works like anything. I mean, so for these 5,000 people, we have avoided the hospitalization. Then there is one more Ayurveda medicine. We call it as a Sitopaladi. That is also a very useful medicine which we are utilizing. And that also has been affected to more than 2,000 to 3,000 people to whom which we have applied for the Sitopaladi. And every day, day and out, every day night, the people are taking Triphala. You know, the Triphala is also very popular and simple medicine for the Ayurveda. These three simple medicine, one, which I said the Sitopaladi. Prior to that, I said the Khadiradivati. And third is the what you call the Triphala. These three particular Ayurveda medicine has stopped them for the hospitalization. And this has been done in front of me because we have a team of scientists, team of doctors who are specialized on critical care services like MD physicians who are working in the Sterling Hospital over here in Ahmedabad, and he has worked in Lilavati in Mumbai. A few doctors who are Ayurvedic specialists. So everybody has applied a different way of their medication. So coming back to our third wave, I personally tell you that these three medicine as people has to start from today. Because before this third wave comes out and your oxygen level goes down, prior to that, you make your body immune into such a system that it will not affect as much as the people are thinking for the third wave. And based on availability of a mutant into the different people which we have tested it out, the third wave is going to happen. And we are trying level best that we should be wrong, that third wave should not come out. But still, I'm telling you that third wave is going to happen for the youngest. It will bypass the immune system. It will not display the temperature or any symptoms. Straight away, you are just like, and all of a sudden, your oxygen level will go down and you will be hospitalization. So these
Thank
are
you
the
so much,
symptoms
Rajesh Bhai.
come out.
This is a very, very important piece of information. I can તમે જે કીધું છે કે ખદીરાદીવતી, સીતોપલાની અને ત્રિફલા આપણે બધે હમણાંથી જ ખરીદીને આપણે મૂકી રાખશું કારણ કે કદાચ third wave આવે, which you are saying that it is going to happen. We can at least prevent so many people who are just running after, panicking, etc. Thank you so much for this. My next question is again with Dr. Pankharia. Dr. Pankharia, we have seen that when the pandemic started early last year, the infrastructure of our country was naturally not equipped. Nobody in the entire world was equipped enough. How do you think the Indian government has handled this crisis overall? Recently, we went through the scarcity of oxygen supply, though, to our surprise, most of the global countries have come to our support and they have sent us maximum oxygen supplies. So what is your take, Dr. Pankharia, on this? And how would you, state that the government is handling this pandemic? How well they are?
It's very heartbreaking to see my fellow Indians in such dire straits. It is a tragedy unfolding in front of our eyes, and it is a monumental tragedy laid bare. There's something called in English called the emperor has no clothes, and we are seeing with India's healthcare system, the emperor has no clothes. I'm so ashamed to have to say it. It is a disgrace. For the last 50 years, there has been underinvestment in the healthcare system in India. Most of the healthcare system in India is in private hands and with private interests. So Indians who are running the private hospitals work according to their own agenda. There is no centralized healthcare system for the people, by the people, developed and made greater and stronger by the government. It is an absolute tragedy. I hope there will be lessons learned from this, that we do need more than 1 or 2% GDP that is invested in the Indian healthcare system. We do need a better healthcare system, centrally funded, centrally driven, centrally directed. It isn't there. Now then, with regards to my emergency preparedness hat, what happened is that India was having a low case numbers 3 months ago. So we're in May now, and in about February, March, the case numbers were down, and the premature celebrations by modelers advising that India has conquered it was a grave error. The grave error of saying our case numbers are low because we are special Indians, because Indians with our special immunity have somehow managed to conquer COVID. And as a result, all avenues were opened up. IPL, the weddings, the political rallies, the transport system, the movement of people, the crowding, the not wearing of masks, etc. And unfortunately, we are paying the price. Furthermore, one more thing I really feel we should be doing and doing urgently, because we've got no time, no other weapons in our hands, is one way to stop it, slow it down, to regain control, is to have extensive, tight, immediate lockdown so that the people who are not infected can be saved. The people who are infected, God help them, because at the moment, the healthcare system is overwhelmed. So with regard to an overwhelmed healthcare system, what we need are many, many, many regional hospitals, field hospitals. So you set up these field hospitals purposefully dedicated to COVID-19 management. And there you have economies of scale. And there where people say, but I haven't got enough doctors and nurses, I say, you doctors and nurses now must train other trainable people to be trained in looking after the thousands of people that need oxygen support and other support in the field hospitals. So it is not a case of the doctor treats, but the doctor becomes the trainer, and the nurses and the other healthcare workers also become the trainers, and you train up several thousand trainable people and run these field hospitals. With the field hospitals, large scale oxygen concentrators, oxygen manufacturers, oxygen storage tanks help, whereas individual oxygen concentrators only go on to help a very few people at a time. We need an intervention of at scale rather than everybody going to hospitals. I have one more and a few more pieces of advice for fellow Indians, which is the majority of you do not need a doctor. The majority of you do not need to go to the hospital. The majority of you need advice and information. And the advice and information is stay at home and see how you go. If you start becoming short of breath, if your muscles and everything are aching so much, if you can't get out of bed, turn in bed, if your oxygen levels are going down, at that stage, you need oxygen support. At that stage, you need to be ready to go to some field hospital. Queuing up to be admitted to hospital when you don't need to be in hospital, or consult with your doctors, or your private doctors forcing you to have MRI scans when you don't need it and you can't afford it, is a disgrace, right? So you need to stop the over-medicalization, over-reliance on medicine, over-reliance on the doctor will make you better, and look after yourself. And then if only you need it, do you press the button and you say, I now need help. So you keep calm, you keep in control, you stay out of trouble, you stay out of getting infected. That is the best way to look after yourself.
Thank you so much, Dr. Actually, I was going to come to the thing which you actually ended with, that a lot of these COVID patients, they go through mental trauma post, if they are recovered also. So what is your piece of advice for the people who have recovered this virus and are now, COVID negative, but they are still going through mental trauma and they're still scared of so many normal things to do. So like so many of them are scared of taking vaccination. Some of them are heart patients. For diabetic, you already have mentioned before. So please give a piece of advice for such people who are going through a lot of mental and emotional traumas.
Well, we can do what we can do. What we can't do, we can't do. Most people will get better. India has a young population, and therefore your chances of getting better, because the vast majority of Indians are young, are very good. So once you have, if you are afraid post-infection, count your blessings, you're alive. And if you're alive, there is hope. And where there is hope, everything is possible. So you look at it as you survived an infection, well done. You're alive, well done. Now, protect yourself. And one way to protect yourself is to have the vaccine. And if you haven't been vaccinated, do so. If you are waiting your turn to get vaccinated, stay out of trouble. Staying out of trouble equals stay at home. Don't mix with people. If you can just keep out of the way for 3 months, you will be in a better place. So what you need to say to yourself is, nothing doing. I'm staying at home for 3 months. Do your bhajans, do your meditation, do your yoga, do your walks, wear your mask properly, wear a high quality mask and wear it properly. Keep out of meeting other human beings. Wait your turn for 3 months, things will get better. I am so sorry. I need to add one little bit here because it is otherwise on my conscience. And it goes as follows. I am trained in the United Kingdom. So I am trained in the medicine that the United Kingdom, the Western cultures teach us. I do not know Ayurvedic medicine. I have no knowledge about Ayurvedic medicine, and I cannot sit here and say that Ayurvedic medicine is the way forward. My answer is I don't know. And the only thing I do know, I have to say to you, which is stay out of trouble. Don't mix with other human beings. Wear your mask properly. Get yourself immunized. Those are the things I do know, and I say that with confidence. With respect to Ayurveda, I don't know.
Thank you so much, Dr. Pradhanya. We are getting some questions from the viewers also. Mr. Bharat Maskara has asked a very relevant question that can a liver psoriasis patient having BP problem can take vaccine?
Yes, why not?
So, I mean, is there any limitation for anyone who cannot go for
Look,
vaccination? Let's take it the other way.
Arey yaar,
Everybody can take
this
it.
is going to save your life.
Right.
Most people can take the vaccine. If you have a severe, gross, multiple allergies condition, peanut butter, peanut allergy, cottonseed allergy, bee sting allergies, etc., severe allergies, then we say maybe preferable not to take the Pfizer Moderna vaccines. Apart from that, in a middle of a crisis, the vast majority of people can take the vaccine.
Thank you so much. I'd like to take another question, which is also relevant. Since you talk about steroids, Jigna Patel wants to know, are they advisable? You already mentioned some people are giving it, some doctors are giving it. On which state steroids should be advisable? This is what she wants to know.
Okay, when I worked in India following the earthquake in Bhuj in Gujarat, I noticed that there was a big tendency amongst the people in Bhuj to have regular supplies and prescriptions of steroids. Therefore, I don't know if Indians are using too many steroids for whatever reason. My answer is, please, especially if you're a diabetic and immune suppressed, HIV infection, TB, etc., then taking steroids is going to make things worse. My view, do not take your steroids. The only time you take your steroids is when you're admitted to hospital and not before. So do not take your steroids for whatever reason. If steroids have been prescribed for a particular condition that you have, all well and good. But for COVID-19 disease, for goodness sake, stop it. Don't take your steroids unless you're in hospital, and at that stage where you need oxygen support, steroids have some benefit. I have to say it. Ivermectin, hydroxychloroquine, remdesivir, no evidence that they are going to save your life.
Somebody has asked me that they have read and heard about this cytokine storms and how are they related?
Storm.
Yeah. So how are they related with COVID-19? And I mean, what is your take on that?
Yeah. So this is the consequence. So as I said to you earlier in my first question to you, which is, unfortunately, the virus arrives. The virus arrives in your lungs and it starts a little pneumonia. Unfortunately, in some people, a cytokine storm subsequently occurs. What a cytokine storm is an exuberant immune response, an overactive and over-the-top immune response. And when you have an over-the-top immune response, you start damaging important organs like your lungs, like your kidneys, like your heart, like your blood vessels, like your central nervous system. So that exuberant, over-the-top immune response is what we call the cytokine storm. And it is when you have that exuberant, over-the-top, excessive immune response that we give you steroids and other immune suppressant drugs to suppress, to reduce that cytokine storm, to bring things under control and hope and pray for the best.
Thank you so much, Dr. Bharat. We will take some more questions for you from the audience. moving on to Ragesh Bhai once again. Ragesh Bhai, we are talking about COVID in India. Why do you think that in India we were not able to manage it after such a long lockdown also, though we have adhered to all the terms and conditions and all the rules and regulation and laws, but why do you think that people still fail to understand the seriousness of this virus? So after you, and then I will move on to Dr. Bhavna Ben. Ragesh Bhai, over to you.
Let me tell you a few things related to this COVID-19. Most of the time, people have felt that it is a medical issue. And I just simply said, the people has to add on to that this is a medical issue, but at the same time, we also feel that these are the likely that it's a biological weapon. Now, if the seriousness of the things has been known to the people that it is a biological weapon, because you just try to understand, whoever is talk about COVID-19, they are all talking about the equipment and devices used for biological weapon. For example, first thing, social distancing, the mask, vaccination, the hot water, steam inhaler, the vitamin C, D3, zinc, which is supportive medicine, which is available over here. These are all we are using for biological weapon if it is happen anywhere in the world. So my question is very simple. The things what the people are using for COVID-19 is exactly the same equipment which is used for the biological weapon. So my question again and again is, it is not a natural virus, it is created virus. And because of that, people are not known the seriousness of it. Now, when the people say in a medical terminology, the variant, it has changed, the virus has changed, is the actually, if it is a say normal virus, it is now say B1.1.7 or V1.1.37. General people has no idea what you are talking about. Try to understand me. But if you have said them, this is a serious, it is, we are thinking it is a COVID-19, but at the same time, you have to be a very serious so that it will affect your body or your whatever you are talking about at the lowest level. So my question is that why the Indian has failed for realizing the COVID-19, the first wave. During the first wave, when everything is become normal, they thought that their immune system is such that they are powerful in the world. That is number one. And that was the mistake, because they never realized that so many variants are available and which is a biological weapons. It will affect, once you are gathering again, it will again get the second wave. Same thing will going to happen if it's after becoming the normal, again people start gathering, it is going to happen the third wave. The reason for that is the particular virus is available with the human. Now, if you take a lockdown, whoever is fine, they become normal after 3 months, and whoever has got the infected, they will get the treatment. This is only the way which we look at the virus on the
I think we've lost connection with Ragesh ji. I will move on to Bhavna Ben. Bhavna Ben, હાજી એક બાર તમારું સ્વાગત કરું છું આ પેનલ પર. Since you have been specifically working on developing patients who have developed kidney failure due to COVID-19, I would like you to highlight that how have you basically witnessed kidney failure, and what is the reason that most of these patients who suffered with kidney failure due to COVID-19 have gone through what kind of medication, or they have not maybe, what is the state of these patients who go through this particular symptom?
Thank you anyway for the members to invite me. At least I can give some update and my perspective for the community here in the UK and also abroad. So thank you very much. And namaskar. Right, so if we look at the kidneys and the kidney patients and COVID, there are two main points I would highlight here. Patients who have got kidney disease, particularly the end-stage kidney disease and who are on dialysis, they're very immunocompromised. Their immunity is very low, so they have got higher chances of catching COVID. And we lost a few patients with this in our first and the second wave because the vaccines were not available. So they had to be protected and they had to be shielding for over a year. And that was a major impact. The other point I would mention here is we dialyze them in the base and on the dialysis unit. So if one patient turns positive, then we get other patients also get infected and the staff also gets infected. So we have to close the unit and also dialyze them in isolation, which puts lots of stress on our resources because we have got limited isolation rooms and also the limited number of people just to dialyze one individual patient. So there have been challenges. Also in the beginning, we had the PPE challenges in all over the world. And for these patients, we needed full PPE kits, which was very, very scarce to get. And the Renal Association UK and all of us did work very hard and contacted Public Health England to support us. So we managed to get through with some loss of lives, definitely. Now, the second point I would mention here is when patients become sick with severe COVID, those who don't have underlying kidney problems, they go on to intensive care units. And then they develop, as Bharat Bhai said, the other organs also get affected. And the kidney failure was one of the commonest complications of severe COVID, particularly in the first wave. There were multiple reasons and the medical reasons. I will not go into the details. And we managed to rectify some of the points in the second wave and the subsequent challenges. But once the COVID illness becomes serious and once the patient is on intensive care unit, the kidneys also suffer with septic and the cytokine storm or whatever we say. And they require dialysis. And once they develop kidney failure, the mortality, it goes even higher. So anyway, in intensive care unit, the mortality of severe COVID patients is around 50 to 60%. But it goes much higher if they've got baseline or underlying other illnesses, or also if they develop kidney failure, because that is a second organ or third organ complication. So it has been a challenge, and we were overwhelmed as a kidney specialist to dialyze these kidney failure patients and to support. And that challenge learned us a lot of lessons. How did we manage to retrieve the resources and get the machines, and the dialysis fluid also was in scarcity. So we learned a lot of lessons there also.
Thank you so much, Bhavna. Since you were talking about since how long all the frontliner medical warriors like you have been facing all these challenges, and you have been working like an army and saving lives. So with everybody across the globe, I want to really thank you, Bharat Bhai and Rakesh ji, such warriors who are the frontline warriors who've been saving lives. And apart from what medical science can also do, you all have been motivating people, keeping them in good spirits, etc. I've got one question for you, Bhavna Ben. So there is this question that what are the residual effects on people who have recovered from COVID? So according to you, people who have recovered, what are the main effects on those people which they may carry for a longer time, or they may not carry it for a longer time? So what is your opinion?
I think now the syndrome is coming out as long COVID syndrome. Some people did not realize in the beginning that there is something like long COVID syndrome. And the syndrome has got wide spectrum, and the symptoms of this syndrome are specific and non-specific. So some people are unable to sleep for a long time, which I had when I had the COVID. I still find it difficult to sleep early at night. And I think people are telling me that you've got long COVID. There are other people who have got very, very difficult, severe difficulty in walking. So they have got neurology involvement. Some people, and the most common involvement is the lungs. Some people are pretty disabled with hypoxia. And the most worrying bit is those who worked at the front line, particularly from our community, they have affected significantly. And it is a pity that some of them are so disabled that they are unable to get back to work as well. So I think I will little bit move on to prevention again. As Bharat Bhai and Ragesh Bhai said, prevention is the best treatment here for COVID. As we know, there is no specific treatment available. Try to avoid getting COVID. I had mild or probably moderate COVID, which I probably got it while working with the COVID patients. But that was good that I did not get into the severe COVID. But still, mild or moderate, you can have long COVID syndrome. So make sure you protect all the measures the government is asking you. Put the mask on, keep the safe distance, do not gather in the crowd, and also keep your windows and ventilation open. One more point I would like to just mention with my own experience, and just a quote and a comment. I think we're talking this illness as if we are politician, we call it biological weapon. If we are scientists, we call it the virus and the variants and the mutations and all sorts of things. But I think the main fight is against the illness. For common people like you and I, everyone is common when they catch the illness. So it is important to protect. Just a little short touch on Ayurveda. Ragesh Bhai mentioned about some of the medications, which I know very well. Again, as Bharat Bhai said, I'm not qualified in Ayurveda, but somehow I got in touch with Ayush Ministry, and I did a lot of work last year and prepared a protocol, which is in the middle of submission for a proper research project for Samsha Manivati Plus, which is Giloy and Pipli. And I also took Ayurveda treatment when I was ill. I didn't take anything else. So I have to say, I do not know much, but the literature reviews which I did, which I can say with confidence because I have done it myself, for Giloy and Pipli, Ashwagandha, etc., there is evidence that there is some antiviral property. It also improves immunity. And there is science behind, because there are studies done in the laboratory animals, and the experiments also have been performed. So I would say, yes, there is science behind it, but that thing has to be coming from those who are qualified. And the main thing which I have noticed, and our trust research department and the MHRS also have agreed, that there are no side effects of these drugs. So you can use them appropriately.
Thank you so much, Bhavna. Moving on to Bharat Bhai once again. Since a lot of audiences are very curious to know about that, we mentioned the third vaccination dosage might be required. What is your opinion on that, Bharat Bhai? And would you please put some light if the third dosage is required, and if the third so-called wave is approaching all of us, especially our country? What are the precautions? How do we, safeguard ourselves? And if it is needed, when do we go for it? Bharat Bhai, over to you.
Yes, that's an easy question to answer. You will be aware that when we immunize children and young adults, sometimes we need booster doses. So you need to look at it as similar to this. We don't know how long the immunity from the 2 doses of the SARS-CoV-2 vaccine lasts. So the first dose, we call it the priming dose. The second dose, we call it the booster dose. And then the United Kingdom is planning this autumn to give a subsequent, meaning a third booster dose this autumn. Now, with respect to this autumn and the third vaccine, second booster dose, we may also reformulate it to mirror the current circulating strain of the SARS-CoV-2 virus. So if there are different variants, we formulate the third booster in the autumn to cover that one. So my view and my advice is please be fully immunized. And then if and when your country or in the United Kingdom, a booster dose is offered to you, please take it, because it is reminding your immune system that you need to be alert to this virus and form good immune response to it if and when it arrives.
Thank you so much. Another question for you is, somebody has written that my mate in UK has first dose of AZ vaccine and his cholesterol is on borderline. Can he take AZ as a second dose?
Yes, why not?
Okay. Okay, thank you so much. Moving on to Ragesh Bhai. I'm so sorry, Ragesh Bhai. I think the connection was lost when you were talking. So coming back to vaccination again, and as far as India is concerned, Ragesh Bhai, there are two vaccinations available here, Covishield and Covaxin. So people have various opinions about these two vaccinations. So are these two similar? I mean, there are a lot of people who are suggesting only Covishield. There are people who don't want to take Covishield and they only want to go for Covaxin and they're waiting for it if it's not available in their city or the nearest hospital. So would you put some light on, so that people get enlightened about if there is a difference or if there is no difference between these two and you can go ahead and take any of these two? Thank you. Ragesh Bhai, can you hear me? Is he mute?
Hello.
Yes, Ragesh Bhai, I can see you.
See, in India, let me go something different route, that it's a political statement that you should take these or you should not take this. So my view, any of the vaccine with the 2 doses, it is sufficient for the second wave. I'm not sure about the third wave, because this discussion we are supposed to take for the third wave. And I must insist now that the 2 vaccination, any of the vaccine, people must take it. The second thing, they must be on the Ayurveda. Once again, I'm insisting, in fact, I'm on the CBRND, but still I'm insisting that you must be on Ayurveda, because we have tasted, I'm telling you, we have an experience on more than 5,000 people, 2,000 plus 3,000. We have avoided admitting to the hospital. So hospitalization has been avoided. And my question, if I had to take a treatment at my home, and if the doctor has suggested that if something is not be all right, then you might have to go for the hospitalization by tomorrow. And even by Ayurveda, if it has been succeeded for 5,000 people, I must say, whatever we are doing, that is to be multiplied. As simple as that. We don't need any research papers on that. We don't need any expert opinion on that. And whatever we have applied, we have a documented, each and every patient documented with us. Whatever their RT-PCR, the CT scan, and the blood report which has been done, those are with us. And on those 5,000 patients, whatever the Ayurveda medicine applied for that, and they have survived. Not a single casualty or mortality rate we have find out from that 5,000 people, which has those been avoided for the hospitalization. So my question again and again, whether you have an experience or not, how many people have an experience of COVID-19 about 1 year back? Can you tell me that answer? Nobody has got that. But Ayurveda is since last 5,000, 10,000 years. Then right now, whatever the medicine which is talking about by the COVID-19, which is 150 years old technology, I just simply use this word. But when you are talking about the Ayurveda, it is a much longer 5,000, 10,000. The charak, I'm using the word charak, is the technology, or what you can use the word, the Sahitya which used for the Ayurveda. They have mentioned these three medicine which I was talking about, the Trifla, the Khadiradivati, and Sitopaladi. Its effects for your immune system, it's useful for that. It is already mentioned in our books, which is available for the Ayurveda. And why not to use that? And we have used it, and people have survived. So my simple question is that whether it is a documented the way what Western countries needed, forget about that. We don't want to document it. But yes, it has affected the patient's life. Yes. 5,000 people. Yes. We have documented. Yes. So we want to use it for this third wave. And we have prepared the kits for the people who has been infected for the COVID. And we have distributed more than 25,000 positive kits, including the conventional medicine as well as Ayurveda medicine. And for the post-COVID, which is more than 50,000 people are using our kits for their post-COVID treatment. So my question is again and again, I'm doing a lot of research work on CBRND, but the similarity between CBRND and Ayurveda, we found a lot of similarity for handling the biological weapons infected people with the Ayurveda medicine. And same Ayurveda medicine we have utilized for the COVID-19 patient, whether of which variant doesn't matter, even up to the second wave. It has really helped to the people for the survival. I'm using the word survival because we have found people are on the ventilator, people are on the oxygen concentrator, because some cases the COVID patient need 30 liters and the conventional oxygen concentrator just produce the 5 liters or 10 liters. And most of the cases we found, the oxygen concentrator doesn't work for the COVID patient. So my question again and again, come to the reality, not on the wording of what the world is going on. Take a practical way of it, that whether really in those conditions, the oxygen concentrator had worked. 5 liters is sufficient for the COVID patient who has been admitted, whose pulse oxygen saturation level, which is found to be around 50, who needs a 30 liters. How can you provide it from the oxygen concentrator? So my question again comes that those patients need that level of oxygenation, which has survived from the Ayurveda medicine. And my sincere request, after admitting that 5,000, more than 5,000 people who has already taken this Ayurveda medicine and they have survived from the hospitalization, one thing is very clear: to get out from the COVID without a casualty, plus avoiding the hospitalization, both the things are very important. And for this third wave, a lot of people are trying with the oxygen and all. That is good. I'm not denying that it should not happen. But you should not forget our own traditional medication. That's my sincere request to everybody who are on this panel.
Thank you so much, Ragesh Bhai. That was quite informative. I will come back to you once again regarding these three medicine you spoke about, and where can a lot of audience would want to order these medications. But another question to Dr. Bharat again, which has come to me 2-3 times, and I think this particular person wants to know that is O negative blood group is having lesser chance of suffering from COVID or having the COVID virus. I mean, Is it true or it's just a myth? I mean, it's just a very simple question, yes or no from Dr. Bharat.
Yeah, the answer is very simple. Please don't sit there thinking you've got a better blood group and therefore it will protect you. We have no evidence that one group is superior to the other. If I were you, I would be taking the strategy of whatever the blood group. Don't get infected, don't infect other people.
Thank you so much. Another question for you, Dr. Bharat, is Sali Patel wants to know, my healthy son who had a first dose of Astra and now due for the second dose, as per current NHS guidelines, under 30s healthy people must take the Pfizer one vaccination. Please advise how, as to which one he should take. Thank you.
Yes, so we are in a very privileged, rich country, and the privilege of the rich country is we can give you Pfizer, Moderna, AstraZeneca, Oxford. So the United Kingdom guidelines are that under 40-year-olds will now be given Pfizer or Moderna. They both work well. So whichever one you're given, just take it. And the reason why we are doing the swap is there is a very rare, idiosyncratic, unexplainable, unusual link with AstraZeneca and blood clots and young people. So we have but the risk is so low and so rare, and we have the privileges in the UK of having alternative vaccines. So we offer you Pfizer or Moderna. Both of them work, both of them will work well.
Thank you so much. Another question from one of our viewers is that there have been cases they have seen here in India with people who were on oxygen or who used oxygen for 4 or 5 days have developed the black fungus. Is it true? Or if it happens, how do we avoid it? How do we fight with this new black fungus?
I addressed that earlier on, and it is not to do with oxygen. It is not cause and effect. What it is that we know for sure is black fungus mucormycosis occurs in people who are immune suppressed. So who are these people who are immune suppressed? 1, people with uncontrolled HIV. 2, people with diabetes. 3, people given steroids. 4, perfect storm, immune suppressed, taking immunosuppressing drugs. And 3, COVID-19 disease. The perfect storm is you are immune suppressed. Then on top of that, your doctor or self-medication, you start taking steroids or immune suppressant drugs. And then you have your COVID disease also suppressing your immune system afterwards. Perfect storm 4, the black fungus mucormycosis to take hold.
Another question for you is, should government of India allow open market policy to anybody to import and start vaccination? What is your take on that?
So is your question that you import vaccines and you use them? No,
Right.
No, I wouldn't go down that route, because we do not know of quality control and providence of vaccines. And it is important that we look after the people, all the people, and therefore the vaccines ought to come from what we would call a chain of command. We know who sent them, we know the batch numbers, we know who received them, we know the cold line chain maintenance, we know the providence from start to finish. And this can only be maintained through proper official channels. Please don't go around importing your own vaccines. You will be deluded. You don't know the providence. You don't know about cold chain maintenance. You don't know if it is fake or forgery. You don't know so many things. Don't do it.
Thank you. My last question to you should be Dr. Bharat. We spoke about the third so-called wave, which may be approaching, soon. So, what is your take on the third wave and how dangerous it can be, and how different it can be from the first 2 waves of COVID-19?
Yeah. So the common misconception amongst many people, including experts, is as if this is like a dinner with multiple courses, and you have a first wave and a second wave and a third wave as if it is something different. What you need to be aware of, it is a continuation of the pandemic, and the waves come as a result of one thing and one thing only: human interactions. So you have more human interactions in a susceptible population, you will get infected. Job done. So if you have a population that is beautifully well immunized, then they will not get infected, they will be protected, they will not end up in ITU in hospital. So these waves are a function of what you get up to. So if you are going to mix with people, you're going to have your large gatherings, you're going to go into crowded buses and trains and shops and weddings and IPL and Kumbh Mela and everything else, you will get infected, you will become ill.
One question which actually is popping up on my mind right now after listening to this is, Dr. Bharat, how soon or how long will this COVID remain, on the globe? I mean, though it's a very, very big question, but so many people and so many friends and relatives of mine are saying it will not go away till 2025, and there's so many, articles going around that. So, if we follow the rules as per what you mentioned, strictly, what do you think is the time frame the world may get rid of this virus?
So if we look at examples of previous pandemics, that is a pretty good guide. The 1918 Spanish flu pandemic lasted about 3 years. And what happens with viruses and their normal biology is with multiple infections, eventually they become less disease causing. And if they become less disease causing, we don't care about it because it's like the common cold. So eventually we expect it to attenuate and become less disease causing. At the moment, we've got variants which appear to be more infectious, but that doesn't translate to they're more disease causing. So that's still positive. And eventually variants will arise, which are infectious, less disease causing, in fact, very mild disease causing, and we'll forget about it. However, there is one other concern, and that concern we are not talking about, which is we need to suppress two concerns. I'll address them both. One, we need to suppress infections globally so that these variants don't keep on arising. So it is in our interest globally to suppress infections everywhere: Africa, Asia, South America, etc. You've got to keep the infections down so that variants don't keep on emerging. That's one thing. The second thing that I'm very concerned about, and not a lot is talked about, is it is potential that this virus can start living in an animal kingdom. So if this virus now starts circulating in an animal kingdom population, be it rats, be it cattle, be it monkeys, be it whatever, then it becomes very difficult to control globally. And we have a problem then, which will result in sporadic outbreaks every few years, depending on what we get up to. So it is entirely possible that this virus starts living in animals, and as a result of starting to live in animals, it becomes that much more difficult to control.
Quite scary actually,
Yes.
what you mentioned.
Yes.
Because we can't prevent this. It, not only animal kingdom, but it can also, go to the crops. And what if it goes into the crops and the vegetables and the grains we are having?
Well, it's unlikely to become a virus of plants and such things. It's not a virus of plants. So I wouldn't worry about that. But it is a virus that can live in other animals. So we got to be careful of other animals, be it reptiles, vertebrates, etc.
Thank you so much, Dr. Bharat. We have a small surprise waiting for you at the end of this panel. I will move on to Bhavna Ben right now for my last question to Bhavna Ben, and then my last question with Rajesh Bhai will be. So Bhavna Ben, my question to you is, મને એવું લાગે છે કે જેટલા બધા પેશન્ટ્સ છે કોવિડ થી જે સફર કર્યા છે or the families who have actually seen somebody who they have lost or who has suffered from COVID. Do you think down the line, a year later, emotionally, we will be weaker people globally, or how it will affect us emotionally? And what should we start doing right away so that, this kind of emotional trauma should not take a toll on all of us?
Right. So there are two things here. The psychological impact of the ongoing illness on the patient and the family, right? And then after COVID, after recovering from COVID, the psychological impact on the patient, again on the family. So there are it is a continuous process, but some patients may not need any psychological support while they are ill. Some patients may need more psychological support, and the family members. I can give my example. My COVID was during the Diwali and on my birthday, right? And my family, we are a nuclear family here. So we had a challenging time. And yes, it was affecting us. And I felt at that time that we do need some more support for the doctors even, and also the family members. So there are some organizations who come up and support. So like in the UK, we have got Seva UK, who have been helping out with the helplines. So those helplines where you can talk to people. I myself have set up an association. We only launched it, I think the main trigger point was my own COVID. It has been brewing for a few years, but British Sanatan Doctors Forum. So that forum is there for people and patients to talk to the doctors, and particularly the frontline staff in this country, because we constitute more than 20% of NHS workforce, and the doctors, if you take it that way, it is 34%. And 95% of the doctors who have died due to COVID are from non-white community, which is obviously presented by BBC. So there is nothing to say no about it. Now, if the doctors have gone through this, the common Samanya people will probably face even more. The best thing to do is during and after the illness, support by the friends and the family, support by the community. And in this country, the helplines are very useful. In India, I think people at the moment, what I feel with my friends and families, and daily we look at the phone, one person has died, the generation has gone, and people are really scared. As soon as they catch COVID, me today I had tears because someone in my family has got symptoms. So yes, they are absolutely panicking, which is not a surprise. At that time, there should be the organizations or the community should be supporting them, and there should be a helpline. Most of us will come out of it, but there will be some consequences on long term. Those who have lost their loved ones, main earner of the family, and also the medical symptoms of long COVID, which will have major psychological impact as well. So they will need support. In this country, we have got some better system. There are mental health support teams available. In India, it is a society who does that. And I think I would encourage in all the parts of India, wherever we can do, to support these people in different ways. They will need monetary support, but also psychological support is equally important.
Thank you so much, Bhavna Ben. My last question to Rajesh Bhai now. Rajesh Bhai, you mentioned these 3 medications, and I'm also aware that you yourself have actually done research and you have come up with a particular combination of these tablets, and which is available with you with your foundation. So would you please put some light on this, because a lot of our audiences and viewers who are watching us right now or maybe watch later would want to know some address or some contact number or some email ID where they can contact you to get these kits you are making?
See, I'll tell you about the 2 different aspects of our organization. One, the Online Telemedicine Research Institute is doing the exclusive research work on the CBRND and the telehealthcare systems and all. And second is the foundation, which is the Premchand Dosabhai Charitable Trust, under which we are handling more than 5 lakh people over here, 5 lakh family rather, in Ahmedabad, Gujarat. So you can understand the થોડુંક હું ગુજરાતીમાં કહીશ so that the lot of Gujaratis which are they are listening, તો એ લોકોને આયુર્વેદા ઉપરનો થોડો આઈડિયા આવી જશે. આયુર્વેદામાં શું કર્યું છે અમે, particularly in the અમારા એનજીઓમાં, કે અમે છે ને COVID-19 ની કિટ્સ બનાવી. COVID-19 ની કિટ્સની અંદર 2 પાર્ટ અમે મેડિસિનના રાખ્યા, એક પાર્ટ એક્સરસાઇઝિંગ અને એક પાર્ટ એને સપોર્ટ ઇક્વિપમેન્ટ્સ. હું તમને થોડુંક બ્રીફ કરી દઉં કે લોકોને કન્ફ્યુઝન ક્યાં છે. કે COVID-19 વર્ડ્સ છે ને એ 1 વર્ષ પહેલા જનરેટ થયો છે, કે કોઈએ પાડ્યું છે નામ એનું. ટ્રાય ટુ અન્ડરસ્ટેન્ડ મી. બાયોલોજિકલ એન્ડ CBRND આ એક્ટિવિટી વર્ષોથી ચાલી રહી છે. અને COVID-19 ની અંદર જે કોઈ પણ પ્રિકોશન, વેક્સિનેશન ના હોય, સ્ટીમ લેવાના હોય, ગરમ પાણી પીવાનું હોય કે બીજા જે કોઈ પણ પ્રિકોશન લેવાના છે, એ બાયોલોજિકલ વેપન્સની અંદર વર્ષોથી જે લેવાતા આવ્યા છે એ જ પ્રિકોશન લઈ રહ્યા છીએ. સો મને એનો વાંધો નથી, પણ ક્વેશ્ચન ઇઝ કે જે જુદા જુદા વેરિયન્ટ છે જે અમારા CBRNDમાં અમે એમ લઈએ છીએ કે આ ડિફરન્ટ જે બાયોલોજિકલ વેપન્સને જે એક્ટિવેટ થયેલા છે એ પબ્લિકની અંદર પ્રેઝન્સ છે અત્યારે. એટલે પબ્લિકની અંદર પ્રેઝન્સ હોવાના કારણે એ લોકોએ અત્યારે જે કેર લેવાની છે એ સોશિયલ ડિસ્ટન્સિંગ, માસ્ક પહેરવાનું છે, વેક્સિનેશન કરવાની છે અને ઘરે બેસી રહેતો દેટ ઇઝ ધ બેસ્ટ વે ઓફ ધી મેડિસિન છે. કમિંગ બેક ટુ ધી આપણા આયુર્વેદમાં હું આવું કે ત્રિફલા જે આપણે કહીએ છીએ, ત્રિફલા એટલે આપણામાં શું કહીએ છીએ કે there is a 1, 2 and 3 fruits. એને આયુર્વેદિક ફોર્મેટમાં ત્રિફલા કહે છે. they are the fruits actually. અને એ ફ્રૂટ્સનો પાવડર જે તૈયાર કર્યો એ what exactly it does કે એને આપણે નોર્મલ ભાષામાં હું જરા સમજાવવાનો પ્રયત્ન કરીશ કે બોડીની અંદર એક્સેસિવ વોટર, એર અને એક્સેસિવ ફોરેન પાર્ટિકલ્સ જે છે એને બહાર નીકાળી નાખે છે. આના કારણે શું થાય છે કે એની આખી ઇમ્યુન સિસ્ટમ જે છે એ ડેવલપ થાય છે. સો આ ત્રિફલા નોટ ડ્યુરિંગ ધી જ્યારે કોવિડ છે ત્યારે નહીં, પણ એની પહેલાથી જો ચાલુ કરી દેશે તો એને કોવિડ આવવાની વાત જ નહીં આવે. દેટ ઇઝ નંબર 1. સેકન્ડ, સીતોપલાદી જે છે એ કફ ક્રિએટ થાય છે. તમે એક દિવસ ટ્રાય કરજો કે સીતોપલાદીને મોઢાની અંદર મૂકીએ રાતના, એન્ડ ઇન ધ મોર્નિંગ યુ વિલ ગેટ આઉટ ઓફ ધેટ એન્ટાયર કફ. અને એ અમે એન નંબર ઓફ પીપલ એ લોકો ઉપર ટ્રાયલ કરી ચૂક્યા છે ને એ લોકોને સક્સેસફુલી આનું યુટિલાઇઝેશન કર્યું છે. અને છેલ્લે જે બહુ મહત્વની બાબત વાત કરું છું કે જ્યારે એને ઉધરસ થશે એટલે ઓક્સિજન લેવલ ડાઉન થઈ જાય છે. જ્યારે ઓક્સિજન લેવલ ડાઉન થાય છે એટલે ઘરની અંદર બધા જ કન્ફ્યુઝ થઈ જાય છે. અમુક લોકો કે છે એને હોસ્પિટલમાં મૂકી દો, અમુક લોકો કે છે એને આ કરો, અમુક લોકો કે સો લોટ ઓફ પ્રેશર ઓન ધી ફેમિલી ઇટસેલ્ફ. હવે આ કન્ડિશનમાં અમે શું કર્યું કે ખદીરાદી વટીનો એને રેગ્યુલર યુઝ કર્યો છે. ઉધરસ નથી આવતી, એનો ઓક્સિજન લેવલ મેન્ટેન થઈ જાય છે અને એને હોસ્પિટલાઇઝેશન એવોઇડ કરાયું છે. હવે આ જે હું તમને આઉટપુટ આપું છું that is of the 5,000 people અને 5,000 માણસ.
Sorry, Ragesh bhai, we have just 5-7 minutes left. I would want you to give the email or contact so people can actually maybe write to you and get more information about.
અને એની અંદર અમે કોઈને ચાર્જ નથી કરતા. અત્યાર સુધી જેટલા લોકોને અમારા એનજીઓ થકી જે આ મેડિસિન પ્રોવાઈડ કરી છે એ બધાને અમે અમારા ટ્રસ્ટે એની કોસ્ટ ભોગવી છે for these all 10,000 or even 20,000 people.
So where
So-
can they contact you? Is there an email or is there a website they can connect with you?
Yes, the email કરી દે અથવા મારો ફોન નંબર ઉપર WhatsApp ઉપર પણ મેસેજ કરશે, which is general to my office also. તો એ લોકોને ત્યાં
Okay.
પહોંચાડી દેવામાં પ્રયત્ન કરશે. At least in Gujarat, એ નેટવર્ક અમારી પાસે છે. તો at least it will take about 1 or 2 days to reach at their location.
તો તમે એ નંબર શેર કરી શકશો હમણાં?
હા, even મારો નંબર હું બોલી લઉં તો ચાલશે કે you want on a
One second, I have your number. One second.
note it down. 83209.
Yeah. Please repeat it. Sorry.
83209 88390.
83309888390.
Yes.
Thank you so much. Thank you so much, Ragesh Bhai. And we thank all our eminent speakers, the committee members. And now I would like to present a surprise to you and Dr. Bharat, which we had actually applied long back for both of you. So here is a certificate of commitment for Dr. Bharat Pankharia from World Book of Records, London. May I request Yatin Bhai to please present it on the screen, and then later on we can give it physically to Dr. Bharat Pankharia.
Thank you. It's lovely of you to look after me like that. I appreciate your kindness. Thank you very much. It's very nice. Thank you.
Pleasure, Dr. Pankharia. It was such a pleasure having you and having so many important information which will be saving so many lives. And I'm sure a lot of people must be benefited with this talk today. Our next certificate we'll present to our Ragesh Shahji, the same certificate from World Book of Records, London, Certificate of Commitment for Ragesh Shahji.
Thank you very much for this wishes. Thanks.
Bhavna Ben, તમારા માટે અમે apply કરી છે આ certificate. We are announcing it today that this certificate will be presented to you soon. The committee has already applied for it since this was actually applied a long back. But thank you so much for being here, Bhavna Pandyaji, and all of you. And now I would like to invite our eminent executive member of the committee, Sharad Bhai Parekh, a Kenyan-born resident of UK with strong roots to India, has been in retail pharmaceutical business. He has been working with passion in the voluntary sector to help address problems and promote the Gujarati community in UK. Work they have done together with Gujaratis in UK, also devoted to advancing the message and the Bhagavad Gita under the UK charity Gita Foundation. It also supports 300 girls at the bottom of the pyramid in education in Gujarat, participating with Yuva Unstoppable. Inviting Sharad Bhai Parekh.
Thank you very much, Smita Ben. Thank you ever so much. Namaste to everyone. This has been an urgent update on the pandemic. And listening to our eminent speakers, we know that we call India the Mystic East, and it's a mixture of today and yesterday. It is my honor and privilege to propose this vote of thanks on behalf of the Gujaratis in the UK. Our guests of honor, thank you for giving us your important insight and your precious time. Dr. Bharat Bhai Pankharia, Dr. Rakesh Shah, Bhavna Ben Pandya, all in the capable hands of our host, Smita Parekh, Managing Director of GLK Global Events. And you are the most valuable participants for the reason why we've held this meeting. We like to thank the technical support offered to us by Yatin Bhai Davda and Nitin Bhai Gupta, Gujaratis in the UK team, Sanjay Jagatia, Mahendra Singh Alija, Dada as we call, Praveen Bhai Amin, Anita Ben Ruparelia, Mr. G.M. Patel, Lalubhai, and Mamta Parikh, and I'm Sharad Parikh. Our gratitude for you, well, Trivedi Live, for streaming the services on YouTube. COVID-19 has been harder than we initially expected. The pandemic has struck a wave across the world, and it has taken everyone by surprise. Our speakers have outlined the dangers we face. We ask you all to take your responsibilities seriously. Don't be relaxed about the virus and its mutants. The new variants may take you or your loved one. So extra caution and care. Please follow the advice that these eminent doctors have given you. Global governments must play their part in securing the supply of vaccines to save millions of lives. Please take care, follow the advice and guidelines given. We will overcome this together. We look forward to meeting you all again soon. Thank you, Jai Shri Krishna.
Thank you so much, Sharad Bhai, and I thank you all of you once again for this fantastic panel. And I hope to see you all again, because I think the more information we share with people who are scared of this crisis and this pandemic, it's better, for soothing down and calming down the anxiety of people. जाते जाते एक मोटिवेशनल नोट पर मैं आप सबको छोड़ना चाहती हूँ कि है जान के साथ काम इंसान के लिए, बनती नहीं है जिंदगी में बेकाम कुछ किए, जीते हैं तो कुछ कीजिए जिंदों की तरह, मुर्दों की तरह जिए तो क्या खाक हो जिए। नमस्कार, जय श्री कृष्ण।
Jai Shri Krishna. Thank you. So shall we break, everyone? And I appreciate that, Praveen Bhai, you both, the Dr. Pandya very well. And personally, I would like to extend the last minute, the inputs he has put it on for us, along with Dr. Bharat Pankhania, who is a good friend, as well as, Ragesh Bhai. So if there's anything else you wanted to say, Praveen Bhai, then feel free, and GM and anybody.
I should thank everybody, and also Dr. Bhavna Pandya, who has come on the board on the last minute, and her experience has been valuable. Of course, we know Bharat Bhai Pankhania has been on the TV and everywhere, and he's so renowned and so trusted, and so valued by the government and British government as well. And Ragesh Bhai has got the knowledge of Indian Ayurveda, which he has displayed today. Thank you very much.
I totally echo, because Bharat Pankhania and Rakesh Bhai, the both of them said to me, Dada, why are you waiting for it? We are there for our community, not tomorrow. Do it now. That sort of, because he is completely dedicated. We are out of India, but India is not out of us. And on that base, I very much appreciate everyone to join us. Please, the past, the good message is to everyone to say, look after yourself, take the advice from everyone there. And we are there to serve. Gujaratis in UK will serve any community, not only Gujarati there. And we are very thankful to everybody, good team, because without the good team, it's not happened there. So thanks again to everybody, and Jai Shri Krishna and Jai Mataji.
Jai Shri Krishna.
Thank
Can we break, please?
Jai Shri Krishna.
Bye, everyone. Do be there. Joining room 1. Okay.
And Dada?
Ji,
Okay.
I think we can we break for a committee only, people? Is it
Yeah.
okay, Yatin bhai?
Can we leave?
Yes, you may leave. I think it's all finished, and thank you for that. And unless anybody wanted to just the but
कोई ना कोई
Yatin bhai,